I'm Megan Gervin, Clinical Nurse Supervisor over at AmeriStaff Medical. We're here to talk to you today about the different types of testing that they're doing for COVID-19 in Oakland County. Now, it depends what you're open for, what you're able to go for. You don't really have to pay for a lot of this. Some places are charging a fee, but most insurances are going to cover the testing without a copay. It's a matter of finding these. You can go on, Oakland County's website and find out where there's some testing sites. You may see one while you're driving down the road, like I did. My boss had actually gone to one too, and told me where to go. Now, there's a couple different types of testing, so I suggest calling ahead to make sure that they have the type of testing that you want. You also want to call ahead and see what times are their busy times. Obviously, there's a lot of people out there that are concerned, or us medical professionals that are going to get tested to make sure that we're not bringing it to you when we're coming into your home and caring for you, even though we're wearing all the protective PPE. Now, last Friday, I went over and I actually videotaped some of these testings so you guys can see that, what's kind of entailed in it and what you're going to see. So the first type of testing that you're going to see is the nasal swab. Now, if you've been tested for the flu or respiratory virus panel in the past, you've already had this done. It's just having it done again to, check for something different. So what they do, they're going to go up your nose. It's going to go back into your nasal cavity. Back here, they're going to swoop it around a little bit to try to collect as much debris back in there and pull it back out. Does this feel good? Not necessarily. The video we're going to show you in a second, I make a nice face at the end. Just your body's natural response to, something going up your nose that's not supposed to be there. So you might sneeze, you might, have a little bit of blood afterwards. If you have inflamed sinuses like I do because of this beautiful Michigan, allergy season starting, you most definitely will probably have a little bit of blood afterwards and a little bit of a nasal drip. Now we're going to show you this video. Please don't judge me too harshly on the face I make afterwards. It's really not that bad, and it's pretty short.
Oh, you've done this before?
I'm a nurse.
Oh, that's right, you are. Okay, so I'm just going to go, as far back as I can here. I'm sorry ahead of time. Okay, I'm going to just do one of those. Okay, you okay?
Yep. Now, the next type of testing that we're going to talk about that I actually had done as well is the finger poke for testing the antibodies. Now, a lot of people are doing these tests now, but they're not giving out a lot of information about them. So how this is done is like if you're diabetic or if you've ever had a little finger poke where they just poke you in the finger with a little, button push guy, they'll squeeze the blood out, they'll suck it up, and they're going to put it on their antibody strips to test it. This one's pretty immediate. You'll get the results back within a couple minutes, maybe up to 15 minutes. The nasal swab that we talked about previously, that one takes anywhere, if you're in the hospital, some of them are up to just 24 hours. Other ones, like I had done, it took 3 days to get the results back. They just take a little bit longer, whereas the antibody testing is quicker. Now, the thing to think about with the antibody testing is that your body takes a while to build an immunity to something. And what they're finding with COVID-19 is people necessarily aren't building an immunity, even if you did have it. Now, if you're wondering if you had it 2 months ago, go get antibody tested and see if you built an immunity to it. But this immunity in your body takes 1 to 3 weeks to actually build up. So if you think you're positive right now, it's better to go get that nasal swab done, which is why a lot of places are doing the combo together like I had done. So we're going to show you a short video of the finger poke. I apologize for which finger is out. That's the one that made me stick out. So we'll have you watch that.
Yeah. Ready?
Yeah. Oh, it's like high school all over again. So I stabbed him in high school with one
Did
of
you?
these. Yeah, to do blood typing.
Ah.
That was pretty funny.
Okay. Just kind of have to work it a little bit.
Yeah, good.
Get a couple of samples here. Especially the cold. Sometimes and the stay is so not fun because it spits it back out all the time when I try to get a sample. I'm gonna go like
Melt
this.
the finger a little.
Sorry. There we go. Okay, let's get this in. There we go. See, that second time around is a little better. Air is flying everywhere. I love it when it's windy. Yeah, it makes it extra special. It's just so fun. When we have our gowns on, and it's like pointless to have them on, you know.
Yeah.
There we go. Let's see. Sometimes I don't know if it's too bad. We'll just have you guys come to the door, you know.
Yeah.
But we really try to have everybody in the vehicle.
That's a good idea.
Am I hurting you?
Not at all.
Okay, good. So you work with the elderly mostly, or?
It's auto home care plus some private pays, and so we have anywhere from young to super old.
All right, my dear, I will be back in just a few minutes.
Now there is a third type of testing that I didn't have done that day, so I don't have a video of me being, poked. But it's a standard blood test. What they're doing is checking serology levels. So similar to the antibody check, instead of doing the finger poke, they're going to take a larger sample of blood and check, all your beautiful immunoglobulins that are flowing around in there. Now, this one's kind of good to go get checked simply because there are a lot of studies going on, a lot of places within the United States and outside the United States that they need data. They need people to go in and get these serology studies, and you might have to sign a waiver saying that it can be used for study purposes. They're trying to get a handle on this, trying to figure out, who's building antibodies, had you tested prior, positive. I've had friends in the hospital test, positive after caring for patients, and then they go in for their serology study and they didn't build an immunity up. So there's a lot of questions out there still. There's a lot that people just don't know yet, and that's why the entire world is still studying this. They're trying to come up, with a vaccine. They're trying to come up with what's going to help us and, help to keep all of us healthy. So always a good idea to, help out, go give some blood. Not that bad. We all know, we go to the doctor. As long as you have a pretty good phlebotomist, it's not that bad. Some people have had some bad experiences, but it's not too bad. And obviously, if you, have any questions, feel free to contact me or any of us nurses over at AmeriStaff. We can help you out with any of those questions at 248-288-2270, or you can contact us at nursing@americaremedical.com. Hope you all have a lovely day.
Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.